Ellie, are we going? Yeah, okay, and we are back to life again. Okay, so now that the line is better, so just now we are saying that Dr. Priscilla has been in this emergency room for 7 years, and it's like Doctor House, Doctor like all these doctor movies that we watch, and I think recently we have this what Amsterdam, right? Also like all the good looking people. So is it true that all the good looking doctors are in the ER room?
I think even if we were good looking, after working in the ER at the end of the shift, we also look like zombie. Patients so scared, takut, Yeah, after
Okay.
the end of my shift, my eyelashes also tercabut, my eyebrow also melt off already. So that's why at the end of my housemanship, I decided, okay, permanent makeup, tattoo here, tattoo there.
You
Okay,
are
that
right.
tahan
You are
two,
right.
3 hours.
Yeah,
Yeah,
yeah, yeah.
yeah.
But I think I hardly see doctors who are so um so fun like you. I think it's really important, because I see you dance Zumba, you do so much of TikTok, and I think especially nowadays, doctors needs to be doing more this type of TikTok video to educate, because if you were to educate in a normal conventional way, it's very very boring. Like the way you do all your COVID video is really really interesting. So if you all have not followed Dr. Priscilla, you can follow her IG. Doctor, what is your IG that they can follow?
Uh, okay, so it's Doc Pris 001, so DOCPRIS, then 001. Yeah.
Okay, so you all can follow her. You can also look at the comment. So you all today we are going to talk some stories from the emergency room. So Dr. Priscilla was saying that there's a lot of repeat customers coming back at the ER. Okay, I didn't expect that. I always think that ER is always for accidents or something that is one time, but there is repeat customer. Why is it so?
Yeah, yeah. So I was saying that we see a lot of, let's say, uncontrolled diabetes. Yeah, even they are really compliant to medication. So we exclude those people that ponteng ubat one, that forget their medication or they don't feel like it. Okay, let's talk about those people who actually are following the doctor's prescriptions, right? Whether
Mm,
be it asthma, bronchitis, hypertension, yeah,
mm,
even heart disease, yeah.
mm,
So in the past 7, 8 years, just being in the ER alone, yeah, I've seen many patients come back even though they tried their best and they can go for all their follow-ups, but maybe at least I still remember when I was in Klang Hta, there's this uncle that comes in every 2 months without fail, almost every month, yeah, for chest
wow.
pains, and then he gets admitted and the whole thing. So I started to think there must be a missing link. The doctors are already doing the best according to the gold standards and guidelines. But then when we send the patient home, they get admitted, they're sick, they're diseased, we correct that, all the deficiencies, then we send them home, right? But how come they come back for the same issues and for diabetics, even if they don't get admitted for diabetic emergencies, right? But you do notice that after maybe a decade or after 15 years, that one particular drug is not sufficient to
Mm,
control the sugar optimally. Then somehow you get a combination of two drugs. Then after that, eventually after 20 years, they start on insulin injections, right? And that itself has some adverse effects as well. Yeah.
mm,
So what I thought was, there must be a missing link. And then when you look back in the textbooks in medical school, they always stress on also on lifestyle modification. Yeah. So what doctors are taught in medical school is, we were given a puzzle, like a patient comes to us is a puzzle, right? And then we run all kinds of tests, yeah, and we figure it
mm,
out. And then according to what research has been done, these are the drugs that we give, right? But
mm,
we don't really look into the food that they take, their lifestyle, their mental health, their support system. So these are all the missing links that, kind of been overlooked in the past couple of years, right? But
mm,
many doctors are actually looking to that now, taking that into more importance, yeah, referring their diabetic patients and really enhancing in their compliance to proper meals, nutrition, teaching them about macronutrients, micronutrients. So all this nutrition knowledge was actually not taught to me in medical school, right? We were taught
mm.
about diseases, what kind of
Yeah,
imaging, what kind of blood tests to run, and then what medications to pair it with. Yeah, not so much
yeah.
on diabetic, cut down on your carbohydrates or up your protein intake, but every individual is different, right? So that's where the nutritionists and dietitians, they work together with the doctors. But then some patients, they don't listen to dietitians and nutritionists, right? They even ponting the appointment, right? But that is so important. And simple things like exercise, just 15 minutes or just walking 10,000 steps a day, that is so important. Even doctors
I
ourselves tend to neglect that.
Yeah, I think especially doctors, you are like doing night shift, 2 nights in a row. I'm sure it's really not easy. And I think a lot of people, they are not looking for lifestyle modification. They are looking for life shortcuts, like if I do this, it's a shortcut, but I would really think there's no shortcuts in a healthy body. So I'm just thinking right now, because you are in a ER, and there's so much of COVID going on. There might be people who they are not aware that they have COVID, right? Then they think that they just have a fever, middle of the night. Then they come to ER. So what happened? How do you all manage that?
Right. At this state, after like 18 months into the pandemic, I think every person that comes in with just a fever or any respiratory tract infection, it's COVID until proven otherwise. So because it's just, especially with the new variant, which is so contagious. So every person, even though they say, I don't go anywhere, I stay at home, then after when you correct a bit more the history, oh, they've been chit-chatting with their neighbor, it goes salam salam, and then, hugging, then the friend come to the house for what, pass some product or something, then they chit chat. Then after, if you dig more history, actually, somehow they kind of neglect the simple things which are like social distancing, which actually really, really, really helps. Yeah. So to answer your question, anybody that comes in or walks in the ER with any cough, fever, definitely we run a COVID test for them, right? But we do not neglect treating the symptoms and the patients as a clinical picture, as a person as a whole, just by just waiting the result. You know what I mean? Yes, we run the test, we take the necessary precaution, COVID until proven otherwise, but we still manage it accordingly because they come in different severities. Yeah.
Understand. So I believe, at this current moment, already 18 months down the road, I'm sure all these frontliners are burnt out from all these rising cases. So do you mind to share a little bit about what is happening in the emergency department right now?
Right. The bulk of us that are really, being hit hard, I would say, are the ones that are in the public sector. Yeah. So even however tired I am also, I will not dare to complain, because when I think about all my comrades, my colleagues, my ex-staff who are actually fighting, really, really fighting, in the private hospitals, right, just to help the patients, and struggle with their own personal life balance as well, right? It's really no comparison at all, right? So I would say that, like for example, there was a viral video last week that was going around, right? That was actually my old hospital. Yeah, it was
Oh,
H-Star Klang. So it really
okay.
hit me really, really hard, because all the scenes, all those zones that they were showing where patients were lying down, even through the front entrance and all that. I used to work there. I used to work, walk on those pavements, right? And then I'm still connected to many of my ex-staff there, even the doctors who are working there. So staff burnout is really, really, it's a real thing, especially in the government sectors, right? A lot of them are working double shifts, yeah? And imagine at the end of the working day, they're so tired. Sometimes they even tapao food, but they don't even have time to eat the food. They don't even have time to drink. We ask patients to drink water, but we ourselves don't even drink. They don't have time to go pee. They get UTI so often, right? And at the end of the day, you go back to your family, right? There's always that fear, Yeah, then they have to swap, they have to take on their role as a mother, and other things when they go home. So the burnout is really, really real. So, simple things like, as the public becomes more understanding, when you go to a government hospital, you don't expect like first class Emirates treatment, right? Right, the staff are barely even surviving. They even probably eat for 9 hours, right? And they do the best they can. They really, really do the best they can. I work with so many nurses, they really try, and nurses really do a lot for the patients. They are more hands-on on the patients than actually doctors,
Yeah.
Yeah, they're actually my heroes, the nurses.
So I also heard that, when they wear the PPE, they basically are wearing the PPE for the whole day. They are not going to pee. That's why you say they are getting UTI all the time, right?
Yes, I mean, if when the you want to save on this kind of wastage of PPE. Of course, we try to minimize, changing, the turnover rates of PPE usage. But of course, if you want to go, they can't like, hey, don't go, yeah, yeah.
Understand. So how is COVID-19 patient treated in the hospital? What are the process actually?
Okay, so when a patient comes to the ER, right, we actually assess them and then we put them into categories. Yeah. So if you're not familiar, I'll just go through briefly. Category 1 is actually they're diagnosed, but they don't have any symptoms at all. Yeah. So category 2, they have a bit of cough, sore throat, headaches, this kind of, mild symptoms like what you get with a normal flu. But then with the new variants, they might not even have those and they might just have diarrhea or abdominal pain. Yeah.
Okay.
With the initial one, very significant was the loss of taste and smell. Then it's very suspicious. But then they're stable. Yeah. So they're stable. Right. So category 3 is when the lung is already involved. Yeah. Category 4 is when the lung is involved and then the oxygenation is low. Then you need oxygen support. Yeah. And then category 5 is the progression of that where you need ventilation support, the machinery support to support the breathing and sometimes the blood pressure as well. Right. So category 1, we assess the patients and we categorize them when they come. Yeah. If category 1, category 2, we can send them home because actually home is a better place for them to recuperate.
True.
Yeah, food, the TV, the family support, everything is there, right? Rather than being confined in a hospital room, even though it's a first class hospital bed, right? And if it's category 3, 4, and 5, yeah, normally those patients are the one that will prioritize for admission. Yeah, then we treat accordingly. Yeah, they need oxygen, we give oxygen, and then we assess whether they need antivirals and all the other medications, right? Some patients with diabetes, their sugar gets haywire because it's fighting infections. So we need to stabilize that as well. If they have asthma, then we treat, so symptomatic treatment as well.
So what is the doctor to patient rate right now? One doctor to how many patients in the government, right?
I really don't have that data right now, but I would say, let's say I would imagine one shift, yeah. And I think in a lot of the government sectors, they don't let housemen deal with COVID. Yeah, it's all the medical officers and specialists. So then you'll be more lacking in manpower, right? So you have a lot of, yeah. So definitely per shift in one zone, there's only maybe 2 medical officers, and then there's like 50, 70 patients, and then it keeps coming in and coming in, right? And like the case in HTA, patients will keep coming in, but then there's also patients pending, waiting for beds. Yeah, 200, 300, nearly 300 old patients still pending for admissions. Yeah, and then you keep seeing the new patients. Yeah. So
So just now
definitely
you're talking about.
yeah.
So just now you're talking about category 1 and 2. They can stay at home and try to recover by themselves. But will they get worse? Like if they are like asymptomatic, will they actually later on of the stage they get worse?
Usually when we discharge patients, we'll teach them to look out for warning signs. Yeah, for example, some that have diarrhea, the diarrhea is persistent, even though we've given symptomatic medications to stop the frequency or the water loss, and they cannot keep themselves hydrated because your body needs water just to have its basic functions to produce your immune fighting cells. So if water, like basic necessity, is even lacking, so how is it able to produce your soldiers, right? So in that case, right, when they are, let's say just severely dehydrated, of course they need to get admitted already, yeah, and they would know. So we teach them to monitor the symptoms, listen to your body, right? Not just neglect it. Since I'm category 1, I'll forever stay in category 1, Category 2 can just deteriorate into category 4 just overnight, right? But there are signs that your body will gradually show, and you need to have, that support around you that can bring you to the nearest facility and be able to pick up this kind of deterioration. Yeah. So usually when we discharge patients, there's some education involved to actually try to teach them how to pick it up. Right. But for patients with no risk factors, who are young, below 50, right? A lot of them, like I said, they just go through it like a normal, flu. Yeah.
Okay. So usually I heard that nowadays after recovering from COVID, there is this long COVID, right? So what is your advice in minimizing all these side effects?
I think in the first place, when we label patients with risk factor, yeah, they tend to recover more poorly or slowly or deteriorate faster, right? Because, for example, if a risk factor such as diabetes or obesity, right?
Mm.
So these kind of things will actually deter your body from actually efficiently producing the the proper immune response, right?
Mm.
So if you want to, be removed from that risk factor category, I think from now people should really start looking into what they eat, yeah, what they put into their mouth, right? Even their mental health as well, right? They just say they're stressed from work, 12 hours you're at a computer, they don't eat properly, they don't drink, right? So all these kind of things have to really be taken into account. Yeah, like still again, their lifestyle is still very important, right? And of course, yeah, you were asking how to prevent, is it?
How to improve, like, after COVID, a lot of people complain that they are still very weak, they cannot breathe at night, they cannot
Mm,
sleep well, and things like that.
yeah,
So what are the advice to improve the situation,
right.
like
So even though,
nutrition
let's
or
say, yeah,
supplement?
yeah.
Yeah.
So even though when you're labeled as an active COVID infection, yeah, initially it was 14 days, then 10 days, then you're off tag, yeah, you're not infectious anymore. It doesn't mean your body is like totally back to normal. It's just
Yeah.
like dengue fever. Even after 1 week, you don't have fever, and then your platelet has already improved, but your body is still remodeling, still patching up all the injury that has been, all the damage that has been done by the virus. So how would
Mm.
you want to patch all these holes in the wall, right? You need to supply your body with the proper materials. So that's where nutrition comes in, right? So when you have your lung already being affected during the infectious phase, right? So the long COVID is dealing with the after effects of the damage that is
Mm.
done, right? So it's all about promoting recovery. Yeah. So nutrition is really key here. Yeah. A lot of people say they don't have appetite, then they don't feel like eating, they have no taste, so they don't eat during the first week. Then that's actually very
Mm.
counterproductive. You know.
Yeah,
Yeah.
true. Especially when you loss of taste, it will be like
Mm.
so weird to eat something that's like totally no taste, right?
Yeah,
Yeah.
yeah. So I tell my patients the food and water is actually like your medicine. Similar to what
Mm.
we were telling dengue patients, the mild ones previously, that yeah, they need to eat, they need to drink because these are things that your body needs to produce the repair to kickstart the repair process and repair efficiently.
What is the key nutritions that COVID patient needs? I heard that there's a lot of people talking about vitamin C, like eating lots of vitamin C and vitamin D as well, I think. So is there any advice on what type of supplements we should take?
Later I can share in the comments and in the link, right? There's this very interesting study, a BMG study, right? It was conducted middle of last year for a couple of months, and they studied
Okay.
nearly 3,000 frontliners, yeah,
Okay.
who are dealing actively with COVID, yeah, and they look
Okay.
into their eating habits, whether they are doing paleo diet, keto diet, plant-based diet, or typical Western junk food diet, and how they
Okay.
recover, what kind of symptoms they actually experience. From this
Okay.
study, it actually concluded that those who are on fully plant-based diet and those that are pescatarian diet, that means they have fish inside, yeah, fish because you have your omega-3s, you have your vitamin Ds. These are the people who actually have very mild symptoms, yeah, and or even if they
Mm.
get infected, they recover really fast. They almost never end up being ventilated. This of course not taking into account those that have diabetes and elderly, right? So actually, in this study, it studies physicians. Exactly, 95% of the subjects are actually doctors, physicians. They are directly
Mm.
dealing with COVID, whether it's in the
Mm.
ER or ICU. Right, so
Mm.
95%, right? So they
Mm.
found that it's over 6 countries in Europe, France, Germany, Italy, Spain, UK, and the US. Right? They found out
Mm.
that, and they concluded that those that were doing the plant-based diet and mixed with maybe those that pescatarian diet, they fare much better. So what do you find in plant-based diet? Plant-based diet, you have a lot of antioxidants, you have a lot of
Okay.
phytonutrients, right?
Okay.
So these are the things that will help your body to fight the inflammation, the oxidative stress that is further caused by the viral damage. Yeah, and for example, in fish, yeah, good quality fish, you have omega 3s. Omega 3s
Mm.
are anti-inflammatory. Yeah. So omega-6 and 9 are actually pro-inflammatory. You don't want that. You get enough of that from your normal cooking oil, from your meat and stuff like that, right? So you want omega-3s in your diet. Yeah.
Okay.
And vitamin D also really, really helps. Yes, you're right. Okay. So yeah. So a lot of people actually thought that, it doesn't matter as long as I'm eating, right? But it turns out it does matter. It really, really does matter.
So it's surprised that we as Malaysian, with so much of sun, we are still lack of vitamin D. Why is it so?
I think we got a lot of sun, but all of us are putera and puteri lile. We all see sun, see like tsunami coming at it. And then we are like, wow, drive cars. So the auntie are like, wow, they wear hat, like those Korean auntie, sunglasses, and then that socks thing. Wow, like I think we don't even go out in the sun. Even in Asia, right? So
Mm.
yeah, even if you want to go in the sun, then you want to take into consideration the UV radiation that is there as well. Yeah,
Yeah.
because of the thinning of the ozone. So that's where supplements come in. You do your part in getting your macro, your micronutrients. You go in the sun, you exercise, right? But then again, there is still a need for supplements, right?
Okay. So I believe in supplements. I have been eating supplements for so many years. Can you tell me why out of so many supplements you choose Nutrilite as the one that you are eating?
Yeah, so I came across Nutrilite because about 3 years ago, I was looking to open a confinement center, right?
Oh,
So I
okay.
was looking for good quality vitamins, right? Really clean source, right? With a long-standing history, with proper
Mm,
R&D into it. And because I'll be dealing with breastfeeding mothers, I'm also a lactation counselor, right? So I'll be dealing
okay.
with pregnant mummies and then postpartum, yeah, very fragile
Okay.
period. So I was looking
Okay.
into very, very good quality supplements. So when I started comparing, I got introduced to my current upline, who's actually a pharmacist by profession, she and her husband, right? So I got connected to her and then she started to explain to me, Nutrilite is already 84 years in the market. Yeah, they're actually the only company that has their own organic farms. So a lot of companies they
Okay.
outsource the raw materials. They get it from other sources, and then really they just
Mm,
process it into powder form. Then they package it, right? But Nutrilite has its own organic farm, so they from seed to supplement, they control the whole process, right? And they've been around for 84 over years. Yeah, they use proper organic products, yeah, produce, and they have over like 900 or 1,000 scientists that are constantly researching on how to better
mm,
their supplements. Yeah, yeah,
mm.
yeah. So when
Yeah,
you
I
look
think
into, yeah,
I take a lot of Nutrilite supplement, like what you say, the omega, I think vitamin
yeah,
C,
yeah,
and
omega.
yes. So, and I love that currently they have the fiber which is in powder form. And yeah, I think drinking the protein don't know for how many years already. So I think
That's why
it's
you have
really,
such
really
nice skin. Yeah,
with Beauty and Co also lah.
yeah, it's a
Both
combination.
I
Right,
think it's
yeah.
really important internal nutrient with the latest technology around actually reversing age is possible in today's technology lah. Okay,
For
so
sure.
okay,
Yeah.
so um, a lot of people are talking about vaccination right now that the vaccination is doing it more aggressively. So once we are vaccinated, are we safe actually?
Okay,
Are we
right.
safe?
So okay, people have to understand what vaccine is, right? So vaccine is giving a round of like a practice round to your soldiers. Your soldiers are your immunity, yeah, your immune guys, yeah, your soldiers, right? So they let you practice 1 round, 2 rounds, so you know how to fight the enemy. So when the real enemy comes, they fight it more efficiently, right? So the
Mm,
whole aim of vaccine is actually to reduce severe symptoms and end up with hospitalization, ventilation,
mm,
and of course death, right? So a lot of people misunderstand or misconstrue that once you get vaccine, it's like an invisible bubble around you, and then the virus will just bounce off that bubble and won't even touch you, right? It's not like that, yeah. So
mm,
vaccine gives your immune system a round of practice. So when they actually do fight the real enemy, they fight it very much more efficiently than if they were just hit, unprepared, right? So
mm,
saying
mm,
that if someone still goes around exhibiting high risk behavior, they're smoking like a chimney, they're eating very poorly, even though after vaccine, yes, the vaccine might have reduced the severity that they might have experienced, but it doesn't. Maybe they would have had category 5, they have category 3. So the progression of the disease depends on their body's ability to fight really. Yeah. And if you have very poor eating habits and then the environment, stress ridden with smoking every like 1 packet, 2 packets a day, then whatever super vitamin or vaccine also cannot help these kind of people. Right? So yeah, but vaccine, yeah, for sure it would actually reduce the severity and then reduce the numbers of people ending up in hospitals. Yeah.
True. So, okay, so like me, I just get my second dose vaccine yesterday. So, of course, right now I can feel a little bit of body aches and things like that. Is this a good time to eat lots of supplements?
I think you eat as you normally do, right? Because these are your soldiers going through a simulated battle, right? So if you've always been taking vitamin C, fish oil, and there's protein, yeah, all these raw materials for your soldiers to fight. Yeah, it's like you're giving them the ammo, you're giving them the baju, right? Right. So just do what you've been doing because you actually already practice very good nutrition, right? So for someone who has never looked into nutrition before this, now is a good time, whether or not vaccine or not. Now this pandemic is a really good time to really reflect on their lifestyle, make some changes.
True.
Are you
Okay.
feeling
So,
okay? Soreness, headache?
I I basically I hate all this type of pains and fever and things like that. So basically, I take Panadol, so just to reduce the feeling of pain lah. So I
Yeah.
think it's okay. I'm quite comfortable because I have been taking Panadol like every 6 to 8 hours. I am taking two tablets of it. So of course I'm also taking my vitamins, especially omega and vitamin C. And occasionally when I feel like my body immune system is low, I always try to take echinacea. I think that is really good. Every time I eat that, maybe for 3 or 4 days, then I can really feel that I am
Yeah.
much better.
Yeah,
Yeah.
the triple guard echinacea is really an immune booster, and you need to take it
Yeah.
only for about 3 to 5 days or so. Yeah.
3 to 5 days. You don't
Mm-hmm.
need to take it for
Mm-hmm.
long term.
No,
If some
no.
if some
Then
people kiasu, they eat every day can.
you not recommended to keep putting your immune system in overdrive lah, actually. Yeah.
Okay.
Yeah.
Okay. So okay, I think we are almost end of the sessions already. So any advice for the people right now? I'm sure a lot of people are getting COVID fatigue, every day are just listening on COVID, very negative things, and sometimes I think mentally also it's quite draining. Some people, they are working from home with their kids and things like that. What do you advise for people who has like almost mental breakdown at this point?
Yeah. I think whenever we are facing a crisis, we have to actually step back, step out of the box, and actually reflect on things that we are grateful for. Yeah, because sometimes we get overwhelmed by all these bad news, and then it's easy to just focus on the negatives, right? And we step back, and then we start to reflect. Okay, maybe I still have a job, I still have a shelter, yeah, and my family are still safe, right? And I still have food that I can provide to my family on the table. I have some emergency funds left. So when you start to write down what you are grateful for, right? Put in a gratitude jar, maybe. Sometimes that actually helps with the distress factors, right? But a lot of people also do not realize that the ability of how someone copes and handles stress also is actually much related to their own physical, let's say, gut health, right? So I've given many talks in the past that relates the health of your gut, your intestines, into mental health,
Yeah.
right? So things like, a proper good quality probiotic, right? A
Yes.
probiotic that is proper, yeah, and fish oil that reduces inflammation, let's say in the gut, yeah, can actually even help with things like anxiety and depression. People don't realize that actually nutrition even helps with that. Yeah. So maybe next time we can
Okay.
have a talk about gut health and how how it affects
Yes.
people's mental status. But I would like to
Yes.
stress that if let's say a person is diagnosed, right? The first thing is do not panic, right? Do
Mm,
not panic. Once you panic, then all logic decisions go out the window, right? So
mm,
get yourself assessed. You could get yourself assessed at the nearest COVID assessment center, CAC.
mm,
There are many CACs set up in all, like nearly all daira housing areas, right? There's doctors there, they can do X-ray for you to categorize you. Then they give you the proper information. Yeah. So if you are diagnosed and you have only category 1, category 2, you're fine. You decide to stay home for home quarantine and you're allowed to do so. Yeah. Then you stay home for 10 days, monitor
mm, mm.
yourself, eat well, watch some comedy, yeah, take it like a 10-day holiday, watch on Netflix, watch Game of Thrones, watch whatever you want, right? So then after 10 days, you go back to this COVID assessment center to get your release letter. Yeah, not everyone needs to put on that pink glove anymore. Probably they're too overwhelmed. They don't get to call in everybody. So after 10 days of home quarantine and you're feeling okay, you go and get your release letter, then your Sejahtera status will all change, right? So when you get
Okay.
diagnosed, of course, you have to do your own contact tracing, try to be responsible, be a responsible citizen, try to inform the people that you have been in contact with the past 1 week or 10 days, get them tested as well. Properly isolate yourself. Don't go and go shopping, go jogging, just be a responsible citizen, right?
Sure.
And the people who are
Sure.
around patients, they have to be supportive. Be supportive of
Mm,
these people who are going through because people who diagnose COVID, they just keep reading about death, all the bad things, but they don't
mm,
read about people who get recovered, right? So
yeah.
these people need their mental health to be taken care as fragile as their physical health. Because a lot of people who are diagnosed COVID, they get stigmatized by society, right? Even
True.
yeah, after they already deemed non-infectious, they off tag already, they get their release letter, they go back to work, right? Their colleagues say, hey, please, I haven't vaccine, please stay 2 meters away from me. This kind of thing really affects the mental state of these people who are still going through the recovery. Some are having long COVID. So be sensitive, do not stigmatize COVID patients, right? Yeah, they're not there to purposely, when they're off tag, they're not infectious anymore. So I think just
Yeah.
with education, the public's fear can be subdued and everybody can work together to actually, overcome this together. Yeah.
So how long do you predict this COVID will be still with us?
Oh, wow. I think it depends on a lot of factors that are out of the hands of the healthcare, right? If you know what I mean. So,
Mm,
ideally speaking, optimistically speaking, yeah, in a year from now, like I said in one of my previous sharing, I hope to be in Bora Bora, right? And working from my laptop in Bora Bora, yeah, connecting with maybe connecting you guys, giving my gut health talk, right? So I'm pretty optimistic, right? I think every party is trying their best. Actually, they are trying their best to try to remedy the situation. Whether they catch up on the situation fast or slow, that's another thing.
So
Yeah.
looking at Singapore and England, that they say they want to live with COVID and no longer wanted to report about the daily cases and things like that. What do you think? Should we actually live with COVID? Because you see, we have been MCO for almost 2 months right now. This round, the number is not going down. The number is actually going up, and I think economically is badly affected. So not only COVID cases now is a issue, there's also a lot of social issue like mental health, abuse, because people staying at home for too long, all sorts of stress, and there's no food on the table for the B40 because they are relying on day-to-day wages, and there's so much other social issue that is coming up. So do you think we should just live with COVID and
I think we can only achieve
practice
that kind of
self-discipline?
yeah. I think we can only achieve that level like in Singapore, our neighbor Singapore and the UK, if the vaccination rate has already achieved a certain level of protection in the community. Then we can
Okay.
go to the next phase where you live with this illness, because as you can see lately, the government is actually reporting the numbers and they break down into category, and you can see that
Mhm.
actually it's the category 1 and 2 that are the majority, okay,
Yeah.
right? So when you want to live with the disease is when the majority is category 1 and 2. And how do you achieve maintaining, the severity at category 1 and 2 is by immunization, by vaccine. Yeah. So once it has already covered a certain number percentage of the population, then we can probably think of executing that kind of, living together with the illness, right? Yeah.
Okay, good, good, good. So I think that's what we wanted to hear. I think looking at how aggressive the government are doing vaccination now, I think maybe in the month of September, I think majority of us are being vaccinated, especially I think in Klang Valley, right? Because that's where all the population and the business activities are. So I am so looking forward to have another sessions with you to talk about the gut health and the mental health. I think that is also another issue that is coming up right now. I can see mental health is not only adults, I think children as well, because they have been like a year and a half, or maybe 2 years, they have no interactions. They are just online. Basically, I look at my daughter. They used to have like recess time, chit-chatting with friends, and after school they play with friends, interact with friends. But right now it's just online classes, and maybe they have a little bit of online game which is causing them have bad posture. Maybe they have bad interacting skill as well, because they are always texting rather than face to face talking. Yeah. So
Yeah.
okay, I really wish to meet again and catch up again after this COVID, and I hope that one day we can really hug each other when we meet.
Yeah, hopefully by Christmas, maybe we get a proper Christmas this year.
Thank you. So thank you very much. So if you all are interested to follow Dr. Priscilla's IG, go to the IG and follow her IG at doc pris 001.
One.
Okay. Why 001? Yeah.
My surname is Ui, so OI, so 001.
Oh, I see. Okay. Okay. Thank you, Dr. Priscilla. Thank you, audience who joined us today. Okay.
Thank you,
Thanks.
Jen.
Okay.
Bye bye. Stay
Stay
safe. Take care.
safe.